So my name's Doug Copley. I've been around healthcare and information security a really long time. Um, I was the CISO at Beaumont Health for several years. I've done, a bunch of consulting for both small, mid-size, and big healthcare organizations. And I'm currently the CISO at Atlantic Care Health System in Atlantic City, Egg Harbor Township, New Jersey, just outside of Atlantic City. So I've got a long history with CyberForce Q, and I wanted to talk today about kind of what we're having to deal with when it comes to AI from a healthcare provider perspective. So, anything else you want to say, Terry, before we kick into the content?
I guess I just want to say thank you, Doug. And we do have people here from like schools and governments as well. But I've seen this before, and this totally applies to everyone. So really do appreciate and thank you for taking us through your wisdom. So looking forward to it. Go ahead.
Yeah, there's not going to be a whole lot of content that I'm going to mention that's really specific to healthcare. I might use some examples from healthcare, but they're really applicable across industries.
Yeah.
So, I did want to talk about how organizations can manage AI risk. It's a very challenging area because of the rapid pace of AI deployment. I also wanted to talk about how it's already being embedded into existing tools, vendors, and workflows. So whether you like it or not, it's in your organization. And talk about how security teams have adapted and how they've had to deal with AI, both from a risk perspective as well as a benefit perspective in taking advantage of some of the AI capabilities. And I wanted to mention that this is really focused on real world experience. I say not theory. There might be a little bit of theory in terms of governing AI risk, but it really is from a practitioner perspective. So let's kick in and just start with, when it comes to AI, who really governs this? Who really tells us what we're supposed to do around AI? And so there's a matrix here, and I want to give a quick shout out. I think it's on, I don't know, it's on one of the next few slides, but I wanted to do a quick shout out to Infotech Research Group. You'll see them mentioned down here in the corner. They are an organization I had a relationship with for several years while I was doing consulting, and they really do provide some great content. So, some of the slides that you'll see in this deck, I pulled, I'll be honest, I pulled directly from their content, just because it's accurate and it's relevant. So when it comes to risk management frameworks, there are several of them out there. The NIST has an AI risk management framework. The ISO practice, or whatever you want to call that organization, the International Organizations for Standardization, excuse me, they have their own framework. A couple of them actually, both 2389 or 23894, sorry, and 31000. And then COSO, which is a big audit framework and control framework, has their own risk management framework that you can adapt to AI. And then the group that published this has their own risk management framework. So this is where you would look for, any kind of government or regulatory guidance or, international best practices around this stuff. So, I did a talk at a coffee and collab a few weeks back, and one of the things I wanted to highlight was just how quickly AI is finding itself into our environments. And I use this slide as an example. I went into our, Microsoft 365 tenant, and in the tenant, they now have a section called AI agents. And I looked in it and I said, okay, well, what's published here? And they have a listing of all of the AI agents that they are publishing to our tenant. So that doesn't necessarily mean, one thing you have to do, right, to try and get your grips around this is understand, are you automatically allowing everyone in your organization to use these as they're published, or do you block them by default and allow them as they are requested or as you review them and want to release them to the org? So in our particular case, we don't have these enabled by default. But if you look at this, what's staggering here is just the sheer quantity. So this is less than 1 month snapshot from January 5th to January 31st. And the column that says first party are the ones that Microsoft publishes that are published or developed internally by Microsoft. So even if you look at that, there's 9 of them that they themselves authored and published in the month of January. But when you look across to the third party and the grand total, it's a staggering amount of AI agents, and sometimes they're releasing more than one a day. So, there really is just a ton of development activity here, and all these things are being pushed to your tenant. So just, I would caution you to, make sure if you're trying to maintain good controls around this, make sure these aren't just being auto-published to your organization. But I wanted to show that just because it was kind of staggering to me when I first looked at that and I seen how many agents got published. There was, I think when you look at the total numbers, it was more than one a day on average. So pretty staggering. This was just a shout out to Infotech Research Group. This is the slide deck that I pulled some of my information from. So when it comes to AI, there's a couple different goals. And this talks about risk management goals, but as an organization, you really need to decide how much you want to leverage AI, or in other words, how much you want to enable people versus how much you want to strictly control it. So I have a slide here in a couple slides ahead that talks about your risk tolerance for your organization. And that is balancing how much you want to enable innovation versus control the risk of it. But first, I'll talk here about how to manage some of the risks. So when it comes to AI, you want to build safeguards. And the safeguards are around the use of it both by the organization and by individuals. And this matters depending on whether you're talking about systems that your organization may be developing versus AI capabilities you may be purchasing, or even your staff people's use of public AI technologies out there like Claude and ChatGPT. So, you want safeguards around these systems. Obviously, for anything you're buying or developing, you want to make sure that there isn't bias in there. That's one of the things that are really important in healthcare, because what may not be intuitive to the general, consumer is that, people's health conditions and people's environmental factors affect your health. And those environmental factors and genetic factors vary depending on where people live and where around the world they live. So, the example I used a few weeks ago was, if I'm building an AI model or we're purchasing an AI model that's going to help predict, clinical issues or, help make clinical diagnosis about people, and we want to use it on a population in the state of Michigan, we probably don't want to leverage a model that was built using data from people in, the Southeast Asia, because they have, different living conditions and a lot of different factors that would maybe not be accurate to the population in the state of Michigan. So bias is really important in healthcare. It's important in a lot of different industries. And, you want those AI models to be as unbiased as possible. Some of these other ones, ensuring accuracy and validity, absolutely critical. And that really gets to making sure that somebody's doing a reasonableness check. Don't just take the output and assume that it's 100% accurate, because especially the consumer models, they are not, and they'll admit it. So, you have to look at the result and say, okay, can you provide me references that demonstrate it's accurate, or can you at least, or does the result make logical sense based on what it is that I asked it to do? So when it comes to managing risk for AI, you want to look and develop some key objectives. So as an organization, what are we trying to do, right? And so we've got a few on the left-hand side here, right? We're trying to avoid unacceptable risks that could affect the organization, right? Or in healthcare, right, affect patients. Another objective might be to train operational risk teams on risk management for AI. So there's people in your organization that already do risk management, whether it's insurance risk, whether it's regulatory risk, whether it's one of many areas of operational risk, whether it's IT or otherwise. But that doesn't necessarily mean they understand AI risks and how to manage them. So they definitely need some training on AI risks and how we manage those. And then if you have an enterprise risk management group or an enterprise risk management framework in your organization, this is going to be another leg of that. So when I think years ago, I worked for a large financial system and they had a very well established enterprise risk framework. And I dealt mostly in IT risk, and IT risk was just one of the areas that fed into enterprise risk. And this is really no different. So AI would be another leg into that overall risk management framework. And then obviously on this slide, we call out, what are some potential metrics to help measure those objectives and targets. So what I mentioned a few slides ago, this is what I wanted to talk about in terms of understanding your organization's risk culture, especially towards AI. So this slide isn't necessarily specific to AI. And I will admit, in my over 30 years of experience in IT, information security, and data privacy, I've struggled to find organizations that understood and managed their risk tolerance well. So lots of us talk about risk tolerance, and we make, risk decisions every day. For example, when we look at vulnerabilities in our environment, we look at critical vulnerabilities, we look at high vulnerabilities, we look at medium risk vulnerabilities. We don't look at low risk vulnerabilities. And that was a risk tolerance decision that the organization made. We said, hey, let's be honest, right? We'll be lucky if we hit all of the medium, high, and critical. And we don't necessarily feel like we have the manpower or we necessarily want to dedicate resources to risks that are low. And so we've made an organizational decision just to accept the low risks. And that's an example of trying to establish that risk tolerance of your organization. So when it comes to AI, the important thing here is trying to understand what the organization's risk tolerance is for AI. I've spoken to organizations that have taken a very risk-averse position where they block access to ChatGPT and Claude and the public models, and they're very prescriptive about what they will allow staff members to do. I would say our organization is more along the lines of a risk tolerant organization, where our organization is much more of the mindset that there is a lot more benefit that can be had from allowing staff to use it. And we'll just manage the risks as they evolve, right? Or as we identify them. So guardrails, certainly, right? But our organization has taken a little bit more risk tolerant approach to say, hey, there's a lot of innovation that we could benefit for here. So I want people out there using AI platforms. We just want to make sure that our data is protected and people aren't putting our data and our patients at risk by using it. So this was really the position that we took, which is, we want to enable clinical and business innovation. We are aware of some of the challenges, and one of those is, shadow AI. And what I mean by shadow AI is AI that creeps into the organization without you knowing it. So people using things you're not aware of, tools integrating AI features that you may not be aware of. And so you find yourself in a situation where there is AI being used in the organization and you really don't know it. And that's, because of the rapid pace of AI, I would say that's probably my biggest concern today. Is not so much the technology, it's not knowing everywhere it's being used because it's coming in so fast and from so many different angles. So we may not even know something is there to try and evaluate the risk of it. So we've provided clear guardrails. Our AI policy doesn't prohibit the use of consumer platforms, but we do tell them how we want them to use them. And so we tell them specifically, don't put any information out there that's identifiable to a unique individual, whether that's a patient or whether that's employee, or even whether it's identifiable to the organization. Because when you write prompts and you get results and you upload documents to those public platforms, there's no telling what other people's results may contain the information that you uploaded to that platform. So we tell people not to do that. We've also struggled, honestly, and I'll talk about this a little bit more, with how to control that, right? So are there ways we can prevent that from happening as opposed to providing people guidance and relying on their understanding of the guidance and their ability to adhere to it. So moving forward, our position on this has been, yes, we pretty much allow AI across the board, but we want people to do it safely. So one of the challenges that we have, and I would argue every organization has right now, is trying to identify AI risk. And the one example I'll use is just a third-party risk management in general. So we have a third-party risk platform that we use, and we've established as part of governance an AI governance committee. The problem we've run into is trying to distinguish what needs to go to the AI governance committee. You know, we do want to do all the things that are on this slide, right? Our compliance as an organization isn't different because of AI, right? AI is a technology. It's not really driven any additional governance or regulatory requirements. And not every AI capability requires a deep review. It depends on what it's doing and what kind of information it's processing. But you know, we said, okay, well, we'll modify our vendor risk assessment process, and we'll ask the questions. Hey, is there AI capability in your product? And if so, we'll direct that review to the AI governance committee and let them look at it. But the problem we ran into is the first bullet point. How do you separate what's AI versus marketing claims? Because what we found is when we start asking these third-party vendors, hey, are you using AI? Pretty much every single one of them respond to that and say yes. Do I believe it? Absolutely not. But I think it's become such a marketing ploy and looking at this as a competitive advantage to say you're harnessing AI, that everybody says they are today, whether they truly are or not. And so, that's caused us some problems in our third-party risk platform because, we have to figure out how to filter what's truly AI and should go to the governance committee and which is not. So as an organization, this is kind of how we look at it. There's things we do from an AI risk management standpoint, and that's primarily done today by IT. The information security team reviews things, the IT infrastructure team reviews things, and where necessary, we bubble things up to the AI governance committee, and I do sit on the AI governance committee as well. So, we have a risk management layer, we have an AI governance layer, and then the organization sets the overall strategy for, hey, how do we want to use AI? And something that is healthcare specific is the predominant value that we see in healthcare is two things, right? There's inherent value in some of the productivity increases you can get by just leveraging AI to do your day-to-day job. And I don't want to discount that, right? Because there is a fairly significant amount of efficiency that can be gained in leveraging some of the Gen AI capabilities. But when it comes to healthcare, the most dominant activity going on with AI relates more to diagnosis and AI's ability to sift through, an enormous amount of data and, draw inferences. So, I'll use an example, detecting breast cancer. AI does an incredible job of being able to do that, but like any AI model, you don't just want to use the AI and say, oh, this person has breast cancer. You still need a physician, and you want a physician to validate what the AI is seeing. But there have been studies that show the AI can detect things, sooner than physicians can. And so, it is that balance. You still need both. But that's where it's really providing value in healthcare, is being able to detect some of these, chronic or critical diagnoses sooner so they can be treated and we can result in better patient outcomes. So in terms of the middle layer here, when it comes to governance, here are some examples of what you may want that governance committee to be in charge of. So we've got, establishing the risk management processes. You do see number 3 there is recommending an appropriate risk tolerance level. So that's one of the things, we put on our governance committee, is to help us establish what our tolerance level is for these things. And then, some of these things could stay at the governance level, some could bubble down to the risk management layer. So I look at number 4 here and says, the impact and likelihood of identified AI risks. Yes, the governance committee looks at that to a degree, but I would argue IT looks at that at a deeper level. And so in our model, that falls more to the risk management layer. But these are just some example responsibilities. You see on the right-hand side, who are recommended members of who should be on the AI governance committee. And in our organization, it's a pretty good cross-section of the organization, because we not only have the CIO as a member, we don't have an AI officer, we don't have a risk officer, but we've got, senior leaders in that group, we've got clinical leadership in that group, and we've got some operational people, heads of our radiology department and heads of IT in there, all trying to collectively provide input on, what are these risks and how do we best manage them. And in the end, they recommend at the bottom here, the CFO should be in there. And, I'm not opposed to the CFO being in there, but I think the point here is you want somebody making a financial decision, because when it comes to some of this technology, it can be pretty expensive. And so as an organization, there does need to be that balance of return on investment. So what is it we're doing? We've assessed the risk to our data and we're okay with that. But do we think we're going to get the benefit out of this that's going to justify the cost of it? And I think that's why on this slide, the recommendation is that the CFO, or at least somebody, is looking at these solutions from a financial perspective. Going one step deeper, this is a sample RACI chart for your governance committee of, who should be accountable for what, and who is just consulted versus who is just made informed of what, the discussions and decisions are. So I won't dwell on this, but, also something I pulled from Infotech Research Group as a sample RACI that you could use for that governance layer. So we've talked about kind of the risk management layer, the governance layer, organizational leaders setting strategy. So how do you pull it all together? And you put it into a roadmap. So, here, we would document, let me see, was it on this slide? Oh, I did have it on the bottom of the slide. I just didn't read my own text here. So I say build out your AI risk program. So let me see if I can pop over to that real quick so you can see what we mean. So I've been a CISO for a long time. Took my first CISO job in 2012. And one of the things that I really like to do, and it's really to help my leadership and to help defend us to cyber insurance companies and assessors is put together a security program document, which really describes all the aspects of how we manage information security for the organization. And this document here is something similar around how you manage AI risk management. So once you establish how you're going to do it, right? Who's going to focus on the identification of solutions? Who's going to look at managing risk of the solutions? Who's going to handle the governance and the monitoring? You can put this all into a program document, and that's what this is. So it talks about the program overview. It talks about a risk council, which would be that governance layer. It talks about accountability for risk management. And then it talks about the activities that you do. So how are you managing the risks? And then you can specifically call out a risk catalog, which are things that that you keep an eye on for every solution that you're looking at. And in addition to that, you can add in, much like you would an information security program or IT organization having a risk register, you can also incorporate a risk register around AI risks just to capture the identified risks and understand how they're being managed. Or you could roll it into your existing risk register if you have one. So that's a security program or an AI risk management program document. But again, back to the overall picture here, this is the things that you would include. It's just in your program document, you would describe these, using words, not necessarily so many diagrams as I'm showing here. So you would talk about, how you're going to govern it in number one. You would talk about where you feel you are from a maturity perspective, which is number two here. You talk about the council, number three. 4 is more around the process for assessing risk. 5 is really that prioritization of, hey, here's the opportunities we have, or we think we have, to leverage AI, and which of them do we want to pursue, right? There's no time and resource to pursue all of them. So which ones are going to give us the biggest return on investment? And then you can build a roadmap based on that in terms of which initiatives are you going to take on and what does an implementation look like. And so I've got another similar document that I can pull up, which is a prioritization map. If I can get it to show up. There we go. Right, and this is just an example, right? No different than it would be for any kind of a project management office. Hey, here's how we're going to assess them, cost and benefit to the organization. Here's the initiatives, here's the value driver for it, and then some criteria to help the governance committee prioritize investment in AI. So I want to give some hard real world examples here. And Terry, how am I doing on time?
You're doing great. I'm sorry. Couldn't find my unmute button. We have about 20 minutes or so. So yeah.
Okay. All right. So I wanted to give some real world examples here. And I talked about some of the struggles that we have with third party risk, but I will say, our risk management approach in the past has been more of a questionnaire mentality where, hey, somebody says they want to do business with a third party. We send the third party a questionnaire. We wait for however long we have to for the third party to fill out the questionnaire, or we keep hounding them until they can fill it out. And sometimes there's big organizations that won't fill them out at all. but the process was a struggle from just a timing perspective. And it was definitely a bottleneck to onboarding new vendors because sometimes the vendors would be responsive and other times they would not. And so it really created a lot of variability in how long it took to assess vendors. And a little over a year ago, we switched to a third party platform that took a different approach. Now we can still do questionnaires and we still do questionnaires, but we also get some data from the vendor immediately. Normally within 30 minutes. So, this is taking advantage of some AI features. So the platform is going out and, pulling any publicly available information that it can on this vendor. It's looking at, it's running basically a scan of their public facing websites. It's going through DNS records to try and identify all their public facing resources. And it's also pulling what it can tell, both from DNS and from other public sources, what platforms it's using, what vendors the vendor is using, and then any known, news articles around it. And so, before it would take us a really long time just to do the initial assessment, and we wouldn't even get in the diagram here, we wouldn't get third-party information. Or in this case, fourth-party information. We wouldn't get vendor geolocation information. We wouldn't get news and alerts unless we manually went out there and searched for them ourselves. And so this has really sped up our process. So we can do vendors much more quickly. And, is the immediate information we get about a vendor really accurate? I wouldn't say that. I wouldn't say it's terribly accurate, but I will say it's directionally accurate. So we can tell comparatively, how does this vendor compare to others? And it's not perfect, but the fact that we can get data in a half hour that before could take us a month, it makes a world of difference. So you can see I pulled this slide back in February, and at the time we had 606 vendors in the platform. That's nowhere near the true number of vendors that we have. And so we continue to expand that, but we also make a risk determination that maybe there's some vendors we don't need in here.